indeed, keeping diseases out of the farm is one of the big goals. And when we think about keeping disease out of the farm, we're thinking about those big diseases, PRRS, PD, African swine fever, those epidemic diseases causing a lot of damage. At the same time, there's also a number of diseases we'll never be able to keep out of the farm. It's going to be difficult to breed pigs without having any streptococci present on the farm, or E. coli present on the farm, or coccidia. Or there's a number of endemic diseases, but also there we can do a lot of good things with good biosecurity, and then mainly internal biosecurity, by reducing the infection pressure.
Welcome to the Swine Canada podcast show, brought to you by Wisenetics. We are dedicated to bringing you the latest insights and discussions in the Canadian pork industry. I'm Miranda Smith, and I'll be hosting today's episode. And with me today, I have Dr. Jeroen Dewulf, who is a full professor at the Ghent University in Belgium. So welcome to the show, Jeroen.
Yeah, thank you very much. Thank you for having me on the show.
Yeah, so today we're going to be talking about biosecurity, which I think is a topic that is ever important and we talk about a lot, but I'm looking forward to getting into more detail with you today. So before we get started on that, can you first give us a little bit of an introduction about yourself?
Yeah, happy to do that. So I'm a veterinarian by training. I was trained at Ghent University in Belgium as a vet, and then I stayed there. I did my PhD on the control of classical swine fever back in the previous century, actually, still. But then that was where I got interested in epidemiology, and I also got interested in understanding how diseases are spreading. And that time, classical swine fever was a big threat in Europe with big episodes. And that was already, at the time of my PhD, I got already intrigued a little bit by the whole biosecurity story, because I tried to go often to farms, to pig farms, and then I noticed that in the models, because as an epidemiologist, you're supposed to do some modeling as well, because that's fancy. And then in the models, all kinds of assumptions were made on biosecurity measures that farmers and veterinarians were taking. They were changing boots and changing clothes, but that was not in line with what I was seeing in the real world, in the field. So at that time, we started thinking, like, maybe we should do like a kind of a questionnaire on, and the word biosecurity was not yet used then, but we called it hygiene measures. And we did a first questionnaire on the application of hygiene measures, more than 20 years ago already now. And we found out that indeed the farmers did not apply what we currently call biosecurity as good as we thought they were doing it. So that was triggering an interest in this. So why is it they don't do this? How can we improve it? What can we do? And that really has influenced my full research career so far.
Okay, so it looks like you've been working on this for about 20 or so years. So would you say, like, in those 20 years, have you seen a change in what producers are doing when it comes to biosecurity?
Yeah, absolutely. Absolutely. There is a big improvement, and that is influenced by many things. And one thing is that we, especially in Europe, but I think that will be the same in Canada, we see lesser farms but bigger farms. So 20 years ago, we had much more farms, but they were typically quite small ones, or we had a mix of big and small ones, but we had a lot of small ones where the biosecurity levels were really, really poor. Those have gradually disappeared, and the ones that stay there are bigger ones with better trained farmers, farming personnel, and a higher attention for a number of diseases. On top of that, we've learned that through some harsh periods, we've had classical swine fever. We quite recently in Belgium had an episode of African swine fever, not in the domestic pigs, but in the wild boar. But we have had all kinds. We definitely have PRRS, like you also have in North America. So we have had a number of big diseases that have caused a lot of damage and have learned people also the importance of biosecurity. So things have improved. There is also much. These days we're talking about it a lot. We give trainings. We have tools available for them to evaluate the biosecurity. So all of that helps to improve it. So I would definitely say it's better than 20 years ago. This does not mean that it's already good enough. So there is still lots of room for improvement.
Yeah, and I think I've had another guest who talked about that with biosecurity, that it's like people, I think, understand that it is important, but it's actually really hard to do it on a daily basis all the time when you're in a hurry, when things are happening. So have you kind of looked into that a little bit too, like people's behavior?
Yeah, absolutely. We've done several studies and we continue to work on that topic. I've had several PhD students actually for whom that was the focus of their PhD, the attitude, the behavior, the social sciences behind biosecurity. And what we really want to do is we try to make biosecurity a part of the daily habits. It should become natural to the farmers, to the farm workers, to apply a certain set of measures. And that is typically something we have been quite poor as veterinarians, as advisors, as technicians in learning and understanding this and advising this to the farmers. And a vet typically comes into the farm, sees a number of issues, start explaining what the issue is and what the solution according to him or her is. And then you expect the farmer to do it. But it's not so easy. And I always compare it to, I give this comparison with smoking. I think we all know and agree on the fact that smoking is unhealthy. There is loads of scientific literature that supports the statement that smoking is unhealthy. But if you have a relative that is smoking and you want to motivate him or her to stop smoking, what we will not do is go to that person and say, look, I have 50 scientific publications of the last 10 years that prove that smoking is unhealthy. I advise you to stop smoking. That's it. Yep. and then we would expect that person, based on that statement, will immediately and automatically follow our advice and will indeed stop smoking. It isn't that easy. And that is the part we often do not fully understand. We are trying to change behavior, change a habit of a person. I mean the advisors, we are trying to change that, but we do not address that in the proper way. We do it with pure technical advices, but to change a behavior, to change a habit, you need more than technical advice. You need incentives. You need different types of stimuluses. You need definitely a lot of repetition. Typically, on average, that's also research that has demonstrated that on average, a smoker will stop 7 times smoking before he or she is really stopping, is really quitting. So they stop, they start again, and so. And that is when I talk to vets, I tell them, well, if you give an advice to your customer 3 times, and they are not following that advice, don't give up. Don't stop giving the advice, but think with yourself, that's okay, I'm only halfway. I probably will have to do it another 3 or 4 times, and only then they will start doing it. And that's simply because we're trying to change human behavior. And we have to understand that is a difficult task.
Yes, it sure is. So I think every producer and person in the swine industry understands that biosecurity is important to keep diseases out of the farm. But are there any other expected benefits of good biosecurity?
There definitely are. So indeed, keeping diseases out of the farm is one of the big goals. And when we think about keeping disease out of the farm, we're thinking about those big diseases, PRRS, PD, African swine fever, those epidemic diseases causing a lot of damage. At the same time, there's also a number of diseases we'll never be able to keep out of the farm. It's going to be difficult to breed pigs without having any streptococci present on the farm, or E. coli present on the farm, or coccidia. Or there's a number of endemic diseases, but also there we can do a lot of good things with good biosecurity, and then mainly internal biosecurity, by reducing the infection pressure. So there it's not black or white. It's not either it's absent or it's present on the farm, but it can also be like, look, the pathogen is present on my farm, but it is present with a relatively moderate infection pressure, which the immune system of the animals can cope with, so they don't get sick. And that is typically streptococci is a very good example of that in the pig farming. There's a number of pig farms that have lots of issues with streptococci, and there's other pig farms that have almost no clinical problems or production effects due to the presence of streptococci. And that's where, with that, biosecurity comes into the play. Besides the diseases, the epidemic diseases, the endemic diseases, we all have the zoonoses. Salmonella is a very obvious one. That's also where, if you want to control salmonella, biosecurity is a prominent component of your control. Then we have reduction of antimicrobial usage. That's also linked to the zoonotic risk of antimicrobial resistance. And also through better biosecurity, we have more healthy animals, lesser need to use antibiotics. If we use lesser antibiotics, we have lesser resistance. So that's also a benefit. And then the fourth one is maybe the least expected one. It's one that is getting much more attention lately, the last 1-2 years, and that's sustainability. The carbon footprint of production, which is becoming very, very important, heavily debated, definitely in Europe, and I would assume that that's the case in North America as well. Well, if you have better biosecurity, you have better production, meaning a better food conversion ratio, lower mortalities, better growth, daily weight gain, and all of this is translated into a lower carbon footprint. For the same amount of produced kilos of meat, there will be lesser CO2 exposed into the environment. So also there we see that is a topic, more novel topic of our research. And now we are trying to focus also on this and trying to really quantify this. In the past, we've quantified quite strongly the link between biosecurity and antimicrobial use. We have a quite substantial body of scientific research that is demonstrating that link and that positive association. It's not only a logical deduction, but it has been shown with real field data that it is indeed, if you improve your biosecurity, you can reduce your antimicrobial usage. Well, that same association we now also want to demonstrate with regard to the carbon footprint of the production.
Wow, that's very interesting. It goes to show that there's a lot more behind biosecurity than just keeping diseases out of the farm.
The funny thing the nice thing about it is that even if you improve your biosecurity to prevent an outbreak of African swine fever, you get for free all those additional positive effects. So there is a lot of collateral benefits, I call them. Instead of collateral damage, you have collateral benefits by improving biosecurity. So no matter what your primary goal is, if you improve your biosecurity for that specific goal, all those other components will be positively influenced as well. So that's really a positive thing.
Yes, definitely. Okay, so switching gears a little bit, can we talk a little bit about the main components of biosecurity on pig farms?
In general senses, we would split the biosecurity into external and internal biosecurity. And external is everything that has to do with keeping the pathogens out. Well, it's even more. It's avoiding that pathogens come into the farm and that pathogens escape from one farm and they go to the next. That's external biosecurity. So when you think about external biosecurity, you have to think about all the things that are coming into the farm or leaving the farm. Those are animals, first of all, but of course also human beings, trucks, feed, water, air, vermin, the unwanted visitors, birds, so anything that comes into the farm goes out of the farm. And for each of these, some transmission routes are more important than others. Bringing in live pigs is always more dangerous than bringing in feed, for instance. So for some, you need much more measures than for others. But for each of these transmission routes, we have to think about what is the risk related to it, and secondly, what are the management options we have to reduce those risks. And these are then quarantine measures, buying safe food, controlling quality of the water, taking all kinds of measures for people that are entering the buildings or exiting the buildings, all those measures. So that's external biosecurity. Internal biosecurity is about the potential spread of pathogens within the farm, from one barn to the next, from one age group to the next, from the sows to the piglets, and so this internal transmission. And what I explained earlier, where it's not about being absent or present of a pathogen, but rather by being reducing the infection pressure. So when we think about internal biosecurity, we think about cleaning and disinfection. If you clean and disinfect the barn in an all-in all-out system, we should not hope that the barn will be sterile. It doesn't work. You cannot sterilize a pig farm, but you can reduce dramatically the pathogen load. So that's what we try to do with this cleaning and disinfection, with organizing the working lines through the farm, going from young pigs to old pigs, or separating if you have multiple workers in your farm, make sure that dedicated people go to this group and other people go to the other group, and there is no mixing. All that type of measures are linked to the internal biosecurity. So those are the two main components of biosecurity.
So have you done research kind of looking at implementing the internal biosecurity measures and then what the disease looks like going around the farm?
Yeah, so we've done a lot of that research, and we continue to do that research. But what we typically do is we go to pig farms and poultry farms, but that is out of scope today. But we go to the farms, and then we give advices on biosecurity, both on external and internal. And so it's difficult to go to a farmer and say, well, we only will advise you on this part. The rest, we know that there is some things that should be done, but we won't talk about it. And so we really work with field data. So we really do the live advising at the farms in real situations. So we address the full farm. We give advices on improvement of the biosecurity, and then we will measure the impact in terms of disease incidence, but also impact in terms of productivity, so the production results, mortality, and typically also what we've done in the past a lot, impact in terms of antimicrobial usage. And what we see, well, in terms of improvement of the biosecurity, it's often easier. Well, we often see that the internal biosecurity is a little bit lesser good than the external biosecurity. So people typically put a lot of attention and effort, have been told about external biosecurity much more than internal, so it's more on top of mind. And sometimes it's also partially in the legislation. They have to do a number of things, or in the quality label guidelines. So external biosecurity typically is a little bit better than the internal, but the internal is typically also more easy to improve. So that's where we can make the biggest gains, especially in the beginning. And the first steps you make were typically in the internal biosecurity. Typically, if we go to farms in a 1-year period, we can improve the internal biosecurity on average with 15 to 20%. External biosecurity improvements will be a bit more difficult because sometimes, or a bit more slow, I would say, because sometimes they are linked to infrastructure. And changing the infrastructure, building or rebuilding or reorganizing some parts takes a bit more time, takes a bit more investments. So that is a bit slower on average. But So that is what we do often on the farms, and we see positive effects. We see these positive effects in terms of production and antimicrobial usage.
Excellent. So when you go to these farms, like how can you evaluate the level of biosecurity?
We developed a tool for that, and the tool that we've developed is the biocheck.eu Ghent. And it's a free tool. It's freely available. So for anybody who wants to use it, it's used actually also in Canada already. And you just go to our website, biocheck.eu Ghent. You Google it, you will see all kinds of different types of surveys to assess the biosecurity for different animal species. And one of the surveys is on the pig indoor production. We also have one for pig outdoor production, and we have one for backyard pig production. But definitely the most used one is the one for indoor, the conventional pig production, I would say. And then you just go through the questionnaire and you answer on each of the questions. And behind that questionnaire, there is an algorithm. There is a scoring algorithm that translates the answers you give into points. And that is a weighted score. So it gives you, depending on the importance of the measure, it will give you more or less of points. So in that way, the level of biosecurity you are implementing in the farm is translating into a score between 0 and 100. And that's how I could say we can improve internal biosecurity with 20%, because we can quantify it. We have a measurement, so you fill in the questionnaire, you get a report, and that report will tell you your overall biosecurity score, for instance, 67%. But it will also tell you your biosecurity score on a number of subcategories: access of animals, access of people, feed and water, management of dead animals and sick and dead animals, or cleaning and disinfection, or measurement between compartments. So there's all kinds of subcategories which are separately scored. And that score card, that report that you get, is actually a kind of SWOT analysis, of a kind of an evaluation of the farm, identifying you the strong parts of biosecurity, but also the weak parts. And it is the starting point of improvement. And because now you know what you're doing good. Typically, farms have a substantial part of the biosecurity well under control. So then you say, okay, that's done well, that's good, keep on doing the good work. But we also identified a number of weak points, and these are the ones we are going to address. And then it's up to the advisor, the veterinarian or others, whoever wants to take on this role, to help the farmer and say, okay, there's a number of things we can improve. Let's maybe focus first on the most important ones, or the easiest ones, or the ones that are feasible within your specific circumstances, and let's improve them. And then you can go step by step. It takes a bit of time. You cannot change a farm overnight, and you cannot do it in 6 months either. You'll take a bit of time, but you can really go step by step and set out a route towards improved biosecurity.
That sounds like a super useful tool.
Yeah, it is. It is used all over the world. We have close to 100,000 farms into the database. Those are not all pig farms, but there's many pig farms. There's not. I have to correct myself. It's not 100,000 individual unique farms. It's 100,000 records. But sometimes farms are coming back several times because they're using the tool repeatedly. And in several countries in Europe, it's even become obligatory, compulsory, to do a biosecurity audit every year. And in many countries, in 8 or 9 countries already in Europe, the biocheck system that we have developed has become the tool of choice for those countries to do. That's why we get this big numbers of data into our database. But I really would motivate the listeners to try it out, check it out. It's totally for free. It's also totally anonymous. And so we're not asking your name, we're not asking your address. The only thing we would ask is the country and the province. That is the only level of detail we have. And then you just start filling in the questions. You'll get a report. and it you will see that that really helps you in focusing and identifying the way forward. And why do we give it for free? Because that's a question I often get asked. That people think, there's something wrong because they give it for free. There is two reasons why we do that. The first one is because we're very nice people. But the second one is maybe even more important. That's because whoever is using it is collecting data for us. So by using the system, our database is growing, and we use that database to do research on biosecurity. And of course, when we do research on biosecurity, when we do epidemiological research as we are doing, data are our most valuable resource. And in the past, we had to go out to all those farms to collect that data, which is a massive amount of work. And now the data almost automatically comes to us, which allows us to do much more research and on much bigger databases.
That makes a lot of sense.
Yeah.
Okay, so is there anything else that you would like to talk about today when it comes to biosecurity?
Well, maybe just one more thing is what I notice often is that people are a bit afraid of biosecurity, and when I talk about biosecurity to farmers, I often get this response like, "Who's going to pay for this?
Right?
Who's gonna carry the costs?" And indeed, there are a little bit of costs related to biosecurity. You have to take a number of measures, use disinfectants and soaps, and you have to buy some additional clothes and boots. But those costs are typically very, very limited. And they are in response to or in relation to the benefits you get from it, they're really, really minor. So my advice would be think about biosecurity as an investment and not as a cost. Think about biosecurity as an alternative to vaccines or as an addition to vaccines. So you can definitely not replace all the vaccines. That's definitely not my advice. But as an addition to vaccines and other preventive measures, feed additives, water additives, whatever you are doing, and it's really an investment. And if you do it smartly, then that investment will have a big return. And don't be afraid of it. Sometimes it's too big. Farmers look at biosecurity and think like it's like a monster coming to them, and it's so big that you run away from it. But cut it in small pieces. Think about separate measures, and install one measure after the other. Continue to work on it, that it becomes a habit. And only if that first measure has become a habit, works automatically without thinking about it anymore, then you go to the next. And if you do it in these little small steps, you will be surprised how easy it is to improve the biosecurity on a farm quite substantially.
It's time for our famous three.
Okay, perfect. Well, that is great advice. So thank you very much for that. So to our listeners, if you're enjoying this episode of the Swine Canada podcast show, please remember to like, subscribe, and share it with your colleagues, friends, and family. So now we're going to the final three questions, which is always the same for all our guests. So the first one is, what is your favorite swine-related book or resource?
Well, I'm gonna be a bit I don't know the correct English word for that, but I'm gonna refer to a book on biosecurity here, and it's a book that we have written together with a lot of colleagues from all over the world, and it's called Biosecurity in Veterinary Medicine and Animal Production, and I really refer to it as the Bible of biosecurity. I've been part of the team that has written the book, so it's in that sense it's maybe not correct that I refer to that one, but that's the one that comes on top of my mind.
Okay, perfect. Sounds like a good book. And then, what is a favorite book or resource of yours outside of agriculture?
Yeah, that's a more difficult one. I have many, But I think the book that have influenced me the most is Factfulness. And Factfulness is a book by a Swedish professor in public health, Hans Rosling, who unfortunately has died a couple of years ago. But it's really about how to make sense out of data and how to understand data and understand the world better by looking at data. And if we do that, you will see that often things are getting much better than we do. We are tended to focus on anecdotes and typically on negative anecdotes. And the best way to explain it is simply by this. Have you ever seen a journalist standing on an airport saying, today 20 airplanes have landed on this airport and nothing has gone wrong? Well, no.
Nope.
No. We never get that type of news, but that's what happens almost every day, except when something goes wrong, that one exceptional time that an airplane has landed wrongly or has crashed, then there's hundreds of journalists standing there to report on that. And that gives us a false idea of reality. And we think that things are going worse, going bad, because we get so much bad news. With that, I don't want to ignore the many things that go wrong in the world, and there are many today, but still, we also should focus on the small, gradual improvements. And that's also relating to the first question you asked me about how is biosecurity evolving. Well, it's slowly and gradually improving, but it has zero news value. People are not interested in that type of slow, gradual evolutions. But whenever we have an outbreak of African swine fever, there will be plenty of reports on that, because that has big news value. And that Factfulness book, in a fantastic manner, there is also a lot of TED Talks by Hans Rosling, if you want to check him. He's one of the most influential speakers of the world. And by the way, when his book came out, Barack Obama was still the president of the US, and he bought 4 million copies of the book, and he donated it to every 18-year-old citizen of the US with the message, I want you to read this. So just to illustrate how impactful it was also, at least former President Obama was convinced that it was a book that had enormous power. And for me, that was the same. Yeah.
Awesome. I'm going to have to look that one up. Thanks for the recommendation. And then the last question is, in your opinion, what sets successful swine professionals apart from those that are not?
Well, I would say openness and eagerness to learn. So being interested in what happens, staying curious, staying open, staying eager to learn from others, to check and to gradually improve. Doesn't mean you have to change over your management every week, because that's not good either. But with sense. But often not often, but sometimes I see farmers that get stubborn, and they say, well, I've been doing it for 30 years like this, I'm not going to change. But that's not that, and that's referring to Darwin. The ones that are survive are not the strongest, but the ones that are most capable of adapting to the new circumstances. And that I think is absolutely the same also for swine farmers. Adapt to the threats, adapt to the demands of the customers, and if you are smart, listen to the good advices of those that have good advices, then you can learn a lot.
Excellent, thank you. So thanks so much for joining me today on the Swine Canada podcast show.
It was a pleasure to be with you.
Perfect. So that concludes another episode of the Swine Canada podcast show presented by Wisenetics. So thanks everyone for joining us today. Don't forget to subscribe to our podcast to stay updated on future episodes. So this is Miranda Smith from the Swine Canada podcast show signing off. Until next time.